This medication is administered through a vein as instructed by your doctor. Before using, make sure to inspect the product for particles, oil, or any changes in color. If you notice any of these, do not use the liquid. Be sure to carefully follow all preparation and usage instructions provided with the product. If you have any questions or are unsure about anything, it's important to consult with your doctor or pharmacist. Do not mix any other medications or minerals with this product, except for heparin. The dosage of this medication is determined based on your specific medical condition, age, weight, and how you respond to the treatment. Be sure to follow the dosage instructions provided by your healthcare provider. Side effects of fat emulsion soybean Oil-Mct-Olive oil fish oil 20% intravenous may include headache, flushing, nausea, vomiting, or sweating. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as signs of infection, pain/swelling/redness at the injection site, bluish skin, sudden weight gain, shortness of breath, back/chest pain, mental/mood changes, bone pain, muscle weakness, easy bruising/bleeding, or signs of liver disease. In rare cases, this product has caused serious breathing problems in newborns and infants when given too rapidly. It's important to closely monitor infants and newborns while they are receiving this product. If you notice any unlikely but serious side effects in infants or newborns, such as rapid/shallow breathing, seek medical help immediately. Although very rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you experience symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report side effects to Health Canada at 1-866-234-2345. Before receiving the fat emulsion, it's important to let your doctor know if you have any allergies to it, eggs, safflower oil, soy, or peanuts, as these ingredients may be present in some brands. This product may also contain inactive ingredients that can cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. Before using this medication, make sure to inform your doctor about your medical history, especially if you have high fat, lipid levels in your blood, liver disease, kidney disease, lung disease, anemia, or a blood clotting disorder. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, there may be a greater risk of experiencing bone pain and mental/mood changes while using this drug. Children may also be at a greater risk for liver disease when using this drug. Newborns and infants may also be at a greater risk for bone pain and mental/mood changes while using this drug. If you are pregnant, this medication should only be used when clearly needed, so it's best to discuss the risks and benefits with your doctor. It's unknown whether this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking fat emulsion soybean Oil-Mct-Olive oil fish oil 20% intravenous, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. To ensure the safety and effectiveness of your treatment, it's crucial to keep a comprehensive list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Additionally, this medication may interfere with certain lab tests, potentially causing false test results, so it's essential to inform lab personnel and all your doctors that you are using this drug. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If a person has taken too much of this medication and has severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Before starting to use this medication, it is important to have lab and/or medical tests done, including a complete blood count, liver/kidney function, and lipid panel. These tests should also be done while you are using the medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. This medication is used as a source of calories and essential fatty acids for people who cannot get enough nutrients from their diet. It is also used to help prevent and treat essential fatty acid deficiency. The dosage of this medication will be based on your medical condition and response to treatment. The best time to take this medication will be determined by your doctor, so make sure to follow their instructions carefully. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose as scheduled. Do not take a double dose to make up for the missed one. Once you have mixed the fat emulsion-soybean Oil-Mct-Olive oil fish oil 20% intravenous, you can store it in the refrigerator for up to 24 hours. Make sure to use the mixed product within 24 hours after removing it from the refrigerator. Do not freeze the product or save partially used containers for later use. It's important to keep all medications away from children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.